I'm Dr. Wynndel Buenger with Interventional Pain Consultants. Today, we're going to talk about something called kyphoplasty. Kyphoplasty is a treatment for a disease process known as osteoporosis. Osteoporosis is a very common disease process that occurs most commonly in aging females. Osteoporosis is due to bone loss. Unfortunately, as we age, our body does not make as much bone. We can help this by taking calcium, vitamin D, but sometimes exercise, calcium, and vitamin D is not enough in order to maintain bone strength. Some medications, like the medicines we use for our stomach to reverse ulcers that some people have to take, also increase the risk of osteoporosis. This happens despite the best care. Sometimes when patients get older or they're put on other medicines such as steroids, the bone becomes weak, becomes osteopenic, which means decreased bone, or osteoporotic, which is severe bone loss. At that point, they can develop things called compression fractures. Compression fractures can happen anywhere throughout the spine, all the way from the cervical region, all the way down through the lumbar region. Compression fractures involve the front of the vertebral body up here, and they form a wedge, and basically the body will become shorter. When the vertebral body shortens, the bones compress. Sometimes the bones can come out towards the nerves, which is called retropulsion in the spinal canal. That's a concerning thing. When that happens, we want it to be stabilized, and we may end up referring someone who has significant retropulsion to a spine surgeon to see if that needs surgically corrected. However, many patients who have compression fractures unfortunately just get the vertebral body height that decreases and shrinks by 10%, up to 70 or 80 or 90%. If that happens, a lot of times the patients just develop severe pain. This pain is terrible when they try to get up out of a chair, when they try to stand up, when they try to walk, if you try to carry something in front of you. This pain is just terrible. It's a severe stabbing pain in the back. It sometimes radiates. It typically does not go down the legs. This pain is very bad. These patients can be treated conservatively with bed rest, with physical therapy such as trying to get them up and walk, but really not stress loading, not making them carry things, nothing aggressive like that. You can try pain medicines to help alleviate this pain. You can try braces to strap around the body to support the rib cage to the pelvis and try to support the fractures. However, when those conservative things do not work, that brings us to a procedure called kyphoplasty. We are proud to use kyphoplasty from Stryker Medical. We utilize either balloons or curettes to go into the vertebral body, directed under x-ray after the patient is given IV antibiotics, pain medication, and a lot of local anesthetic. We go ahead and we'll numb up the skin, and then we'll direct our needle into the bone, and we'll enter through the back of the bone, safely bypassing the nerves into the vertebral body. Under x-ray, we'll make space, and once the space is safely made, we'll place cement, such as this picture here is showing the balloons going through into the vertebral body. And at that point, once the balloons are inflated or the curettes placed, at that point we would place the cement into the vertebral body. The purpose of placing the cement in the vertebral body is for structural reinforcement and strengthening. Once someone has had a kyphoplasty at a level, that level is pretty secure from fracturing again. That bone has been strengthened with methyl methacrylate, and it's unlikely to have further degeneration. At that point, we will refer the patient to their primary care physician to treat the osteoporosis. or we'll help make other referrals to treat the osteoporosis. If you have more fractures, those can subsequently be treated if necessary. Not all fractures require treatment. Some fractures are not painful. However, when you have that debilitating fracture, IPC is here to help you. Have a good evening.